Yeah, let's talk about that routine starting early. So when do you start this? When do you recommend parents start this routine?
So you could start wiping the gums before any teeth are in, just to get your child desensitized. Don't go crazy with it, but it will help them get used to the sensation of brushing. Once that first tooth comes in, you can introduce a soft bristle toothbrush as well as toothpaste. So a rice-sized smear of fluoridated toothpaste under the age of 3 is the recommended amount, and over 3, we want a pea-size amount.
Okay, great. And then what kind of position do you recommend?
So this
Like, how do you
depends
really
on.
get in there?
Yeah, that's the million-dollar question. It makes a huge difference. Like, people ask me how I do it with my child, and it's been a lot of trial and error. It's different than seeing patients. So, when he was 6 months, I'd hold him in my arms and take a little gum cloth or the toothbrush and rock him because he wouldn't move around, to just kind of move his arms with my arm. Now that he's older, we do it before bath time, so he's laying on the bed in front of me. His head is between my legs, and my legs are over his arms. So, I'm controlling everything, I'm able to see everything, and I use one of my fingers to open his gums, like, open his jaws, and people ask me once they have molars, just stick your finger behind their molars so they can't bite you. It helps open up the teeth, so you get all over the mouth.
Yeah, that's actually something I could use the tip on. It's like when you finally get in with the toothbrush and maybe they're willing, they bite down on it. So
Yes,
what, you just stick your finger in like
and try
far
to
far
keep.
enough?
Exactly, behind the gum pads helps open it up, and I don't think I've ever brushed my son's teeth in the bathroom. People ask me this as well. I keep a
Mm.
toothbrush by his changing pad or next to the bed or by the bathtub because having a backboard helps control their head and back a little more, so it gives you a little more control, less movement from them.
Oh, that's brilliant. I never thought about that. I would put him on. I have a 2-year-old. I have 7 and 5, so we've been through it, and thank God their teeth are fine. So he did something right. But the 2-year-old right now, we're like really going through the phases of what she'll allow, what she won't allow. But she actually got used to like being pinned down, where she would ask to go lay on the bed and get pinned down because it was like part of our routine, and we made it fun for a short amount of time, and then we moved on. But
Yeah.
it worked. It worked.
I love it. No, it's spot on. It does work, and it's efficient, like I said. If I'm holding him in one arm in the bathroom with a toothbrush in the other, everyone's frustrated, we're not brushing well, and it just ends up being inefficient.
Yep. Okay. What about toothbrushes and toothpaste? Are there things that you recommend? I see all these electric ones. I see the different kinds of toothpaste, and we should talk about like other things actually, which I'll get to in a minute.
Yeah, absolutely. So in terms of a toothbrush, like I said, soft bristle, because if it's too hard, you could damage the gums and the outer layer of the tooth. Usually for kids, I like a small head because it lets you get in and around the mouth a little easier. In terms of electric versus manual, really whatever your child lets you do, you could introduce the electric as soon as you want. Some people say around age 3, that's when they tolerate it. But again, it's going to be a sensory experience for them. So as soon as they're comfortable and allow it, it's good. It helps clean the gums well.
Okay, so it's better than the soft bristle once it's tolerated.
Yeah, it does tend to clean the
Okay.
gums a bit better.
All right, great. And then toothpaste, what do you recommend?
So toothpaste, we get a lot of questions on this as well. Both AAP and AAPD recommend fluoridated toothpaste as soon as that first tooth erupts into the mouth. So, like I said before, rice size amount under age 3, pea size amount over age 3. Training toothpaste is really just to get your child used to any different texture or flavor. It doesn't necessarily help the teeth in any way.
Okay, so fluoridated toothpaste, even if there's fluoride in the water.
Yes, so fluoride in the water and fluoride in toothpaste serve two different purposes. Fluoride in the water is going to help mineralize developing teeth that are in the jaws that haven't yet erupted, whereas toothpaste is going to help mineralize topically, meaning by brushing on the teeth that are in the mouth.
Okay, and there's another that you said training toothpaste. What is that?
That's toothpaste without fluoride. So I know there's a lot of conversation around fluoride. People are scared about the safety. It's extremely safe. It's a public health success and win in preventing cavities. Um, I've been using fluoridated toothpaste for my son since 6 months, and I recommend it to every single patient. It helps those teeth.
Okay, and there's this other I'm like totally forgetting the name of the ingredient in it. It's not like the crest, it's like the Toms. What's in there? Do you know
Probably
what I'm talking?
hydroxyapatite.
Yeah, how what's your feelings on that?
So the studies on hydroxyapatite in a toothpaste are relatively new. This data that's out there has shown that it's as strong as half strength fluoride. So, if for whatever reason you're hesitant with fluoride, it's a good second option. I think fluoride is a tool in your toolkit to help prevent cavities. Same with hydroxyapatite, but there are a lot of other puzzle pieces to the puzzle, like nutrition, diet, going to the dentist, all these things.
Yeah, and if the water does not have fluoride in it, you recommend taking a fluoride supplement. Is that correct?
Yes. So whether that's drops, chews, pills, you could speak to your pediatrician or pediatric dentist about it. Depends on your location, like you said.
Okay, and what's the like risks and benefits of that? Like what if someone doesn't do that? What do they risk?
You're at risk for increasing likelihood of cavities. You're really helping build in the mineralization into those developing teeth to set a healthy foundation for teeth down the line.
Which is why it's so important.
Exactly.
Okay. And when do you recommend we send our kids to the dentist for the first time?
So guidelines officially say 6 months within the first tooth erupting or by age 1.
Okay, got it. I think this is extremely important because back to what you said in the beginning, it's about setting the patterns and the positive reinforcement and learning from very young how important that dental care is.
Absolutely. And I think a lot of people don't realize there's this huge age between 6 and 13 years old where we have both baby and adult teeth. And if the baby teeth have cavities, that bad bacteria, and that's the environment in the oral cavity, those adult teeth come into that. It's very easy for the adult teeth to get cavities in that environment as well. That sets the stage for the rest of our life.
Yeah, so important.